Okay, so this is the baby CPE. I'm already in the patient's room right now, so obviously the mom's not going to have a random baby in her room, so I don't need to redo WIPA, just rewash my hands, of course. I already know this is the mom's baby. So I can begin my assessment. I want to start by listening, so I have my stethoscope here. And I would first listen to the heart under the left nipple and then one other spot. I would listen for a full minute and the rate should be 110 to 170. I would also listen for respirations, the patterns just like an adult. So I'd listen to multiple spots on the front of the baby as well as back of the baby. And it should be 30 to 60 respirations, that's normal. I would also take the baby's temperature under the arm and it should be 97.5 to 99.6. Also, a good teaching moment would be that the magic number is 100.4. If the baby's temperature reaches to 100.4, that's not good. It needs to come to the doctor, as well as mom. When listening to the heart as well, you could hear a murmur in newborns. That is common but not normal, so that would be something. You don't want to have any respiratory distress in the baby. That's not a good thing. That's a low APGAR score, actually. So at this point, I would be looking at the baby's eyes. I'd look at the conjunctiva, the sclera. It could have a blue tint to it at birth. I'd look in the nose and the mouth, make sure it's patent. I'd look at the ears and the eyes. If the top of the pinna here and the eyes, they're supposed to line up straight across on both sides. Also, I would check the head out, make sure there's no deformities on the head. Sometimes they have a little dent on the back of their head, that's okay. When I'm looking in their mouth, I probably need to have a glove on for this part, but I would check to see if there's any teeth. There shouldn't be. Those need to be removed if they do. Also, if they have really thick secretions in their mouth, that could be a sign of cystic fibrosis. So you need to teach the mom about that if there's thick secretions present. The baby would not have all these clothes on, so when I go to assess the skin, I'd make sure it's moist. It's going to be peely. I would assess to make sure that the nipples are present. The color of the baby's skin, the temperature, does it have any rashes anywhere? The baby has a dent in the top of the sacrum right here. It can be a sign of spina bifida, so that's another teaching moment for the mother as well. I would listen to bowel sounds on the baby in the same order as you would an adult right here. You do not, absolutely not, palpate a newborn's stomach. While I'm at the stomach, you would check the umbilical cord as well to make sure there's no infection or any bleeding from that, anything wrong. I don't have a bulb syringe, but if I did have one, I would use it. I would make sure the air is out of it before I take it near the baby. It would go into the mouth first and then the nose to pull out the secretions. The first reflex is the rooting reflex. I would touch the baby's cheek. It should turn and look at me. That's good. I would have gloves on for this part as well. I'd put my finger in the baby's mouth, touch the top of the palate inside of the mouth, and it should suck on my finger. So that's a good reflex. There shouldn't be any thrush. The lips and the palate should be intact when I'm feeling that. So that's good. While I'm in there, I would also assess the tongue because if the baby has any issues with its tongue and how it formed in the womb, if the mother's breastfeeding, the tongue can cause damage to that, so I need to make sure I'm assessing the tongue. Another reflex is the fingers inside the hand. So if you do that, the baby should squeeze. That's the palmar reflex. If I pull the arms up, let go. That should startle the baby. That's the Moro reflex. Same thing with the toes. Sorry. If the fingers in the toes, so if I put it, it's just like the hands. So they should kind of squeeze their toes into my fingers. That's the plantar reflex. And then the last one, you run from the heel to the big toe on both feet. They should wiggle their toes. That's the Babinski reflex. Next. I would take baby's diaper off. I would assess the genital area. If it's a female, her labia majora will cover up her labia minora. If it's a male, I would want to, if the mother decided to circumcise the baby, I would look at the circumcision site, make sure there's no excessive bleeding, redness, warmness, any infection going on there. I want to make sure it's going on well there. I would want to look at the symmetry of the anus. I would also check if it's patent. I would feel, just like an adult, I would feel the arms and the legs of the baby for muscle tone and strength. Are the muscles well formed? Does the baby have good range of motion with all its extremities? Is it pretty strong? At this point, the baby's probably really mad at me. It's probably already crying. If not, I'd want to stimulate it a little more, get it crying, because I would want to evaluate that cry for the APGAR score. I'd also want to check cap refills in all the fingers and all the toes. And while I'm doing that, I'd want to count to make sure they have 10 fingers and 10 toes, because sometimes they do not. I would check all the pulses. The brachial pulses are up here in newborn, not really anywhere over. I check the brachial, the femoral, and the pedal at the top of the feet, both of them. I can also walk my fingers down the baby's collarbone, and it checks for crepitus and alignment, because sometimes they're born with unaligned collarbones, and that can cause issues with the baby. I think that is it for the baby assessment.